Good morning, everyone. I'd like to start with some good news. Overnight, WA Health has reported 0 new COVID-19 cases in Western Australia. That means we now have 8 active cases, all of whom are in hotel quarantine. And our total number of cases since the start of the pandemic remains at 1,121. In other good news, Western Australia has hit another vaccination milestone. Currently, our vaccination rate for those aged 12 and over is 85.3% for first doses. For second doses, the rate is 73.4%. This is very encouraging. To put this in perspective, we announced our safe transition plan less than 3 weeks ago, and that means that nearly 120,000 extra West Australians have had their first dose since then. It's a fantastic result, as every day more West Australians follow the science and the health advice by coming forward, doing the right thing for themselves, their loved ones and the community. As we've been repeatedly saying, we know the virus is coming to Western Australia. And when it arrives here in Western Australia, it will find those people who aren't vaccinated. That's what we're seeing in other states and other countries around the world. Our progress means we are on track to reach our goals for the Safe Transition Plan to lock in the date to ease our controlled border measures. But we need to keep the momentum going, especially given the vast size of our state. The best way to keep pushing our vaccination rate up, in conjunction with the workforce mandates, is to make vaccinations as easily accessible as possible. We know that it works. Our successful Supervax weekend at the start of November saw a 12% surge in vaccinations through our state-run clinics. So today we are announcing a new strategy to further boost momentum, our Summer Vax Drive. Starting this Saturday, our Summer Vax Drive will involve 3 weeks of targeted promotions, events and opportunities for Western Australians to get vaccinated. Firstly, there will be new pop-up clinics at specific Woolworths and Aldi supermarkets. The exact locations will be announced soon, but they will be across both metropolitan and regional areas on December 2, 3, 4 and 5. There will be 11 metropolitan locations and 5 regional locations. Secondly, there will also be pop-up clinics at cricket matches at Optus Stadium during November and December. This will start with the women's BBL final this Saturday that obviously features our Perth Scorchers. So get behind our team and get your vaccine at the same time. It's easy. A pop-up clinic will also be available at the BBL match on Wednesday, 8 December. Fans and staff will have the opportunity to get vaccinated then and there. Can I thank Woolworths, Aldi and Cricket Australia for their help on all of these measures. Finally, we will also establish the COVID-19 Vaccine Community Funding Program to help boost the uptake of the vaccine in priority groups, including Aboriginal and other communities. The Health Minister and Vaccine Commander will talk more about that in a moment. All of this in addition to the existing state clinics at over 100 locations around Western Australia, as well as GPs, pharmacies, Aboriginal medical services and respiratory clinics run by the Commonwealth. It's all about making vaccination as easy and accessible as possible. My advice is simple: don't wait. We expect that clinics will be busy next week before the next wave of mandates kicks in. So I encourage everyone to get it done as soon as possible. There are so many reasons to get vaccinated. It reduces your risk of catching the virus. It reduces the severity of the disease if you get it. It dramatically reduces your chance of hospitalisation or winding up in the ICU. It dramatically reduces the likelihood of you dying. Right now, over East, the overwhelming majority of COVID cases, hospitalisations and people on ventilators chose not to get vaccinated. I bet they regret that choice. Yesterday, Victoria reported 19 COVID-19 deaths, 19. Of that, 17 were unvaccinated. That tells the whole story. It's not just about protecting yourself. We know the vaccine reduces your risk of passing it on to someone else, of passing it on to someone you love, like a child or an elderly relative. The more people who get vaccinated, the safer everyone is. The fewer restrictions we need to place on everyday life, the fewer lives lost, It's time to do the responsible thing, the right thing, the adult thing, for your community, your loved ones, for yourself. We need you to get vaccinated. I'll now hand over to the Health Minister.
Thank you very much, Premier. Thank you very much, everyone. Look, this is another great initiative to increase our vaccination rates and improve the vaccination rollout. It's also another innovative way that we can approach the vaccination of all people. And WA has had a remarkable run of COVID-free days in the community. We have been as safe as anywhere in the world. But that is all going to come to an end shortly. For almost 2 years, we've been trying to keep COVID out. We have protected the lives of Western Australians, and this in turn has protected WA and the Australian economy. But soon we'll be in a strange new situation of bringing COVID-19 into WA. It's going to be a reality check for many people. People are going to get sick. Some people will get very sick. So our focus between now and early next year has to be on getting as many people as possible vaccinated and as soon as possible. To put this into a clearer picture, in New South Wales between the 16th of June and the 7th of October, they admitted 1,015 people into their ICUs. Of that 1,015 people, only 47 were fully vaccinated. And of those 47, the average age was 82. So this is a disease of the unvaccinated. And our best way to respond to the inevitability of it coming into our community is for people to vaccinate as soon as possible. And that's why the initiatives like this summer Vax Drive are so important. And it's why the support of businesses like Woolworths and Aldi is also greatly appreciated. About 1,885,000 Western Australians have now rolled up for WA. It's a massive number. We're less than 2 Optus stadiums away from seeing 2 million Western Australians roll up for their first dose. So I want to thank everyone who has rolled up so far. And I want to thank everyone who has supported the vaccine rollout and helped spread the word to get vaccinated. Ignore the noisy, tiny minority and listen to the almost 2 million West Aussies who want to protect each other. I want to see everyone support the vaccination program, on both sides of the Parliament of Western Australia. We need to be in this together. I've said many times that we can't leave anyone behind in the vaccination effort. We need to all be in this together to protect each other. The recent outbreak in the Northern Territory and the concern about it in far northwestern Australia has brought this into sharp focus. The Aboriginal vaccination rate has actually been increasing well and faster than mainstream community in the recent weeks. But it is still only at around 48.7% for first dose and 32.6% for double dose. So we have to do better. There are a lot of people doing everything they can to lift this. And if you can help in any way to spread the word, please do so. It is safe and it is important to get vaccinated. Just finally, I want to mention the SafeWA app. Tomorrow marks 1 year since the app was launched. It has been phenomenally successful, particularly during times of potential community transmission. And I want to remind everyone to keep using the SafeWA app. And if you've stopped using it recently, please take up the habit once again. There are more than 1 million scans yesterday, so we know people are continuing to use it. But it's vital that we maintain this habit and get back into the habit of using the SafeWA app. So just a few stats to leave with you in relation to that. We have over 2 million individual registrations for the SafeWA app, as well as over 90,000 businesses that have registered. So during the year, we have had over 463 million total check-ins. That's a significant number, but we need to keep up that effort because when the disease comes into our community and we have to do our contact tracing, it is so important that we have that data to draw upon. So don't be complacent. Keep checking in, and above all else, get yourself vaccinated. I hand you over to the Commissioner.
Oh, good morning all. I firstly want to start by thanking all of the West Australians who have made the time and effort to be vaccinated. Having now tipped over 85% first dose, we're well on track towards the 90% double dose when we can start opening up back to the rest of Australia and the world. And when we do open up, it's been made abundantly clear that COVID will enter Western Australia. Police have put extra efforts in and around the Northern Territory border. Northern Territory announced 11 new cases today, bringing that cluster to 51. We're putting as much effort as we can for people that are travelling on the back roads between WA and the Northern Territory, and we're highly vigilant about that. It doesn't matter if you've got a philosophical position about this vaccine. The vaccine doesn't care about that because it'll come and find you and infect you anyway. That's why it's so important. We're only 1 month away from Christmas. It's a busy time of year, but I'm urging anyone who has not been vaccinated, please take what opportunities are out there. Cricket Australia are working very well with us. They want to fill that furnace at Optus. They want to beat the record of 41,900 at a WBBL game, and this is a great opportunity for people, if you haven't been vaccinated, to go and enjoy a wonderful sporting event, and you can also take the opportunity to be vaccinated. I thank also Woolies and Aldi for their cooperation in these weeks ahead. It'll be ever more convenient for anyone to get vaccinated. What you've done to date is tremendous. The fact that we haven't had COVID running through our community and achieve what we have today. There's just that effort we need to get to 90% double vaxxed in the new year, and we'll be then in a much safer position. Thank you.
Could I just ask a quick question for the Commissioner while you're up there, sir? In relation to the cricket, when the football held the grand final here, 62,000 people thereabouts, you did a pop-up clinic there, and I think you got 2 people showed some interest. What's going to be different now?
Well, look, it's a different event, Jeff, and in this sense we're making every opportunity count. What we don't want is people to say, well, why didn't you? So look, to me, it's not a waste of resources, it's an opportunity to keep people safe, and that's the focus we have. People will take whatever options available. We know that some people haven't been sufficiently motivated. That's why the shopping centre efforts are working really well. The ones at Armidale, Mirrabooka, Ellenbrook are really bringing in the numbers. That's why I think this effort with Aldi and Woolies, same with the cricket. If there are people that are going there, they've got time. The grand final was busy and focused. It was underwhelming in terms of the vaccination effort, but we want to make every opportunity count.
No doubt these venues, Optus and Woolies and Aldi may unfortunately become targets for some of these anti-vax groups. Will there be any more police efforts for this time period? Look,
the police are at all of our clinics, either static patrols or frequently patrolling them. We've charged at least 6 people with serious criminal charges. They're before the courts. Some have already been sentenced who have been threatening the Premier and other people. We will continue to be highly vigilant about that. They will have no room given to them. So while some are given move-on notices, I've instructed my officers to charge people with criminal offences whenever possible, because they should not be protesting in the manner in which they're committing and threatening people. If they're committing criminal offences, they'll face charges.
Have you done any more surveys or research on vaccine hesitancy in the state at the moment since the mandate announcement?
Look, there are regular surveys, but the Premier might be able to add further to that, but certainly the hesitancy surveys continue. They have been going for some time.
And have you seen any change in hesitancy increasing or decreasing since the mandate announcement?
Just in moderate terms. Look, we know that there are some indicators there, but look, I think as the milestones are being reached, we're seeing greater numbers of people being vaccinated. So look, we're taking stock on some of those.
Just one on the police matter itself. Mick Kelly came out a couple of days ago pretty strong on wanting the around 20 officers and staff that have come out and said they won't be getting the jab to remain in the force and be redeployed, perhaps working from home. Is that potential consideration at all?
No, he's wrong. They won't be working from home.
Obviously, remote Indigenous communities are still a problem. Are you making inroads there, and what do you plan to do to boost those numbers, because they're still quite low?
I was with Minister Dawson and other people yesterday speaking to a number of those communities, and look, in one community, I won't cite which particular ones they are, 95% of that community are fully vaxxed. Tremendous. But you then speak to another one, 80% are yet to take it. They were just being described as stubborn. So look, I and the Chief Health Officer will be visiting a number of those big communities personally to explain to them, and I'll have the Chief Health Officer with me. Some of the questions they've got are simply information about the vaccine itself. So having the Chief Health Officer there will add to the information that's already available.
Is it true that there's religious groups going out to Indigenous communities telling them that the vaccine is satanic? And are you doing anything to battle that kind of misinformation?
Look, the communities that have been cited to me when I've put that to them, in fact, have strongly rejected that. There are some videos and some misinformation that's gone about. One of the communities that was being cited to me as not taking up the vaccine because of religious beliefs are in fact quite disturbed and upset to be labelled like that. While they're a faith-based community, they say it's nothing to do with that. They don't believe the beast is in the vaccine. They're quite strong and indeed upset about it. And I can understand why, because they're being labelled wrongly by anti-vaxxers. So the information is out there where some people are peddling this sort of information. But look, one of Australia's most respected Aboriginal pastors, Ray Minikin, has put a contrary message out which has been spread across some of these communities to counter any of that false narrative.
Just on the December 1 vaccine mandate, many of those captured are public sector employees. Do you have an idea of how many public sector employees are going to be jobless from next Wednesday?
We won't know until that date. So there are surveys being conducted, but look, while people have got now another 6 days before they get vaccinated, it'd be wrong for us to speculate too heavily on that. We don't anticipate the numbers to be great though.
We've touched on it. The Premier's obviously received multiple threats towards himself, his family and his staff in Rockingham. Have you received any anti-vax messages or threats as the vaccine commander?
Yes, I have, and a person's been charged.
What was that threat, sir?
Oh, just in terms of people that are wanting to shoot the Premier or me.
Was that to your phone, or can you?
No, look, I won't expand because the matter's before the court.
Can you say when you received the message?
Oh, look, I've had several. My intro's pretty full. All right, I might leave it to the Premier.
Premier, yesterday you described the nature of the threats to you on Saturday as sort of being the sort of thing of Muslim fundamentalist extremists. Have you had any blowback because of that?
I understand I received a letter. Obviously, I didn't mean anything offensive or insulting by that, and obviously, if anyone took offence, I apologise. Was it a Muslim organisation that wrote to you? Or I think it was an individual.
We've seen reports that you are considering shifting your family from their home. Is that correct?
I answered those questions yesterday. Look, obviously, you just consider what's going on and make decisions accordingly. But I haven't made any decision at this point in time. The people involved in all this share my address all the time, and so it's a bit of a problem.
South Australia has apparently recorded 1 or 2 COVID cases today. Are they still, as I understand it, still?
Yeah, look, the advice... Sorry, you go, Jeff.
No, I'm just... the question was, are they still only being monitored, or have you got is there anything further on South Australia?
No, the advice we received this morning was that was an historical case. So, as you know, there's people described as shedders. So when they get tested, they are releasing the the virus that was historic. So we're not advised there's any new cases in South Australia at this point in time.
And with 6 days till the December 1st deadline, do you have any concerns about the resources industry, operations like Alcoa that may be short of workers and may have to curtail some of their activity after December 1?
No, I don't. The resources industry is very resourceful, and I'm sure they'll manage these things well. And I just say to anyone who works in resources, you have a great job, you have a great career, you have a great future. Just get vaccinated, and you'll make yourself safer and healthier, and you'll avoid losing your position.
Those companies haven't indicated to you whether they're going to have a labour shortage because of the vaccination deadline?
No, I understand one or two smaller companies may have raised a couple of issues, but overwhelmingly, and I mean overwhelmingly, the industry is supportive of what we've done. Have we not, just to put it in a bit of context, over the course of the last 2 years, we managed to keep COVID out of the industry despite everything going on around Australia and around the world, and kept it open and operating and functioning, and it delivered enormous revenue both to the Commonwealth Government and the state, and kept everyone employed. We want that to continue, and the way to make sure that continues is to have the workforce vaccinated.
Have you been briefed on how many people in the FIFO workforce are going to quit?
No, I haven't, and the experience, as I've said a couple of times, we had exactly the same issue in the aged care workforce, whereby people were saying they weren't going to continue, they weren't going to get vaccinated, and virtually to a person, they got vaccinated. So as the deadline approaches, people see sense, they get vaccinated, life goes on, they keep themselves safe, they continue to be employed, and in due course they wonder what all the fuss was about.
Given we're 73.4% for the second dose, do you have a week or a date where we may hit that 80%? So then you can give us a date that...
It'll be early December, first half December.
Just looking ahead, cricket-wise, the Ashes, obviously still some negotiations around the quarantine requirements. Is there any update on that?
No, we haven't got a final answer, but cricket has to adhere to the rules. So they haven't made any decisions. I've seen some organisations putting ads out there and so forth, saying everything's been decided and that sort of thing. They're all wrong. There hasn't been any decision made. It's really up to cricket now whether they want to adhere to our quarantine rules.
Just on the crowd vaccine, obviously 31st of January is when that will be required off the stadium, but would you consider enforcing the crowd to need to be vaccinated? Adelaide Oval have already said for their test match, which is before the Perth one, that anyone attending would need to be double jabbed to enter the stadium. So would that be an early consideration to...
No, we haven't considered that. We've announced the Safe Transition Plan. It kicks in on the second mandate kicks in at the end of February, and when the exact date for opening borders and all those other things kick in will be late January, early February.
Is it the English cricket team that's holding up approval for...
I'll leave that to Cricket Australia to explain. But, there's obviously, they have their own considerations, but we have our considerations. So our considerations are we need to keep the state safe. And so whilst we get to that 90% vaccination rate. So, look, I know we're only a matter of weeks away from that. And we just need to get people vaccinated in the lead up to that. And there'll be a lot of, turmoil and trouble and consternation, as there has been over the last 2 years in the lead up to that date. And I just urge cricket just to comply with the rules as other sporting codes have.
Well, while on sport then, can I ask you about the Dockers' very optimistic overview for their immediate future? 2 premierships in 4 years, one for the guys and one for the girls, and a whole bunch of other things.
I just wish they'd aim a bit higher. They're really, they're just...
They're coming off a very low base.
Well, they're so pessimistic. I just wish that my team would aim a bit higher. What's wrong with 4 out of 4?
Exactly.
There's a national debate at the moment about whether children should be captured by the vaccine mandates. And just with regards to what's happening in WA next year, will kids aged 12 to 5 who are not vaccinated be banned from events with 1,000 people, like sports carnivals, footy matches?
We haven't had any health advice to that effect, so that's not something we've considered. We think the opportunity for 5 to 11-year-olds to get vaccinated will become available sometime in January. but we certainly had no health advice to that they shouldn't be allowed to go to concerts or football or what have you. Look, there's always going to be issues coming along. Our main aim at this point in time is get people aged 12 and above vaccinated to at least 90%. Now, we're tracking that way. We're over 85% first dose, so that means we're definitely going to get to over 85% two dose, and our numbers go up each and every day. And as the deadlines approach, we expect the numbers will go up significantly. So we're very confident we'll get to over 90%. When you think about it, in a world sense, in a world context, that will mean we'll have one of the highest vaccination rates in the entire world when we haven't had a major COVID outbreak. Now, a lot of countries and a lot of places get higher levels of vaccination because they have outbreaks. People rush to get vaccinated because they don't want to die. Now, we haven't had those COVID outbreaks, yet we are still tracking towards very high levels of vaccination. So that's a credit to the overwhelming majority of West Australians who are just doing the right thing, listen to medical science, don't listen to the conspiracy theorists, and get out there and want to protect themselves and their community.
Sorry, just to be clear, my question is, will kids aged 12 and over need to be vaccinated to come into WA to attend events with more than 1,000 people?
Oh, I thought you said 5 to 12.
No, I was talking about 12 to...
You said 12 to 5. Anyway, now, just in terms of the vaccination rules, at this point in time, it is over 12s. So if for travel and those sorts of things, it's over 12s.
What about third dose for children from 12 to 16? Third dose is a very hot topic at the moment.
Well, that's not one of our vaccination mandate requirements, but we would encourage everyone, when they get to be eligible for the booster, which is 6 months after their second dose, please go and get the booster. So at some point in time next year, I'll be leading delegations to various countries around the world to restart relations and business and that sort of thing. I'm going to make sure I have the booster before I do it.
On Woodside's Scarborough project, just can I clarify your comments? I think it was yesterday. Were you saying that the state government would step in if there was adverse findings through the Supreme Court action?
So the Supreme Court action, we'll let it run its course, but you can't have, and they'll administer the law, of course, but we can't have scores of industries closed down because of a court ruling. So the state government will do what it has to do to make sure industries stay open.
The Conservation Council was pretty disheartened by your comments yesterday and said that they were just trying to make the state government and the companies abide by the laws that already exist. How do you respond to that?
No, clarity in the law is a good thing, and so if there's clarity in the law, that's a great thing, but we can't then have a whole range of industries closed.
So what's at risk in this Woodside proposal is there's the one kind of key environmental approval that is being argued over, that they got this approval to expand Pluto, kind of a bit of a free kick. There wasn't much consultation or review of it, and that's the point of contention. Does that really risk other industries?
Yes, it does, for two reasons. One is other industries or other projects have received approvals that this might have an implication for, and secondly, obviously, we want to keep the lights on, and we want to make sure that our hospitals continue to function, and we need energy for that purpose.
What do you make of protesters today chaining themselves to blocks of cement on the road to stop workers getting into that site today?
I haven't seen it. I've just heard about it. Look, peaceful protest is fine, but I think that's probably going a bit far. They should protest in other ways.
Just on the surveys again, the hesitancy surveys, the Commissioner mentioned that there's been a moderate change in hesitancy from the surveys. Is that more hesitancy? And I know there was already 15% or so that the Commissioner said would be a problem. Is that a bit concerning, given that you're aiming for this 90% vaccination rate? Well,
we're over 85% first dose vaccination, so we breached the 15% group, if you like. Look, my recollection of it, and I haven't been briefed recently on it, and obviously we have to do this sort of work to make sure that we appeal to people to follow science and medical science to save their lives, so there's obviously ongoing research about it. My recollection of it is the actual group who are anti is very, very small. There's a group who are perhaps there's a group who are perhaps ambivalent, another group who are perhaps a bit apathetic, another group who think it won't come to me because they live in the country, and that's the group that we are working on to get them vaccinated. And obviously all the things we're doing, the workplace mandates, the advertising campaigns, the summer vax splits, the huge number of clinics around the place are all designed to get that group vaccinated.
How taxing are these threats and continued protests? Obviously, we've seen videos of people coming right up to you and right up to your car. Is it affecting your work, and how long do you think this is going to continue?
No, it's not affecting my work. Look, I expect when we get to the 90% double dose vaccination, we reopen borders and reopen internationally and interstate, which is late January, early February. I expect a lot of this will dissipate. And I expect a lot of the people who are not vaccinated, when they see their friends going off to Bali or London or Sydney or Melbourne, will suddenly go and get vaccinated. And particularly as we see all the people who are vaccinated have no health impacts, no adverse impacts, apart from the fact that they reduce the risk to themselves from COVID. And also, when we get transmission of the virus in Western Australia at some point in time next year, I expect a lot of the people who aren't vaccinated will rush to get vaccinated. So I'm not too worried about it in a personal sense. Well, you know, it's not pleasant in a personal sense, but the main thing I'm worried about is making sure people get vaccinated before they catch COVID. Because once you catch COVID, rushing to get vaccinated won't help you. When you're going into hospital and when you're struggling to breathe, you know, when your lungs are filling with mucus, getting vaccinated won't help you at that point in time. You've got to get vaccinated before that.
One for the Health Minister, if I may.
Am I finished?
Can I just ask quickly, the Heritage Bill passed, there's still a lot of concern about it. Why does it need to be rushed through this year?
The thing about the Aboriginal Heritage Bill, it's been consulted for 4.5 years. We've had hundreds of consultation sessions, thousands of people involved to get the best model legislation in the entire country. And the thing about it is you have to actually make decisions. You have to actually do things. If you procrastinate and delay, these things fall by the wayside because they become too hard. And that's what's happened with every other time the governments have tried to legislate for this issue since 1972. So we're a government that believes in taking action, making sure we're protecting Aboriginal heritage and making sure Aboriginal people are involved up front in the decision-making process, which is what this legislation does.
And does it guarantee there won't be another chicken gorge disaster?
Well, as best you can via legislation, yes it does. Thanks very much.
Just a couple of if I may.
Sure, Jeff.
You spoke about the people are going to get sick because the virus is going to come to WA. You quoted some New South Wales figures.
Yep.
Just with Western Australia, is our health system going to be up to it, and would you bet your job on it?
Look, our health system will be up to it, and that's the reason why the Premier and I made the announcement earlier this month for the extra 270 beds as part of a $400 million investment in our health system. That will ensure that when the disease comes to Western Australia, and that will be towards the middle of next year in terms of the expected peak, that will ensure that we make sure that we have the beds and the resources we need. Now, obviously, staffing is going to remain a big challenge in relation to that. I think the workforce issues will continue to challenge us, and which is the reason why we've invested so much in our overseas and interstate recruitment campaign. Yesterday we announced that we've decided the locations for the new modular beds, which will be part of an interim expansion or lift surge of our capacity to make sure that we continue to provide world-class healthcare while keeping an eye on the infection rates with regards to COVID-19.
And secondly, the move yesterday to put MPs on notice that they won't be allowed into Parliament House if they can't prove their double vaccination status would probably see 2 MPs not being able to attend Parliament if this follows the normal course. Would you happy to have 2 MPs elected by the people to be forced to stand out?
Well, look, if that's what it takes to make sure that we can maintain a safe working environment for the people who are in Parliament House. But can I just say to all members of Parliament, this is a matter of leadership by example. And we know that the Western Australian community in the times of these sort of challenging times look to the leadership, and it requires everyone, particularly in terms of our major political parties such as the Labor Party and the Liberal Party, for people to stand up and do the right thing. So it's really incumbent upon the leader of the Liberal Party to speak to his team, to implore them, in fact, to instruct them to do the right thing, to lead by example and make sure that they get vaccinated, but not just get themselves vaccinated, also talk up the importance of of everyone in the community getting vaccinated. And I really think it's a derogation of a parliamentarian's responsibility to the community not to be promoting the vaccination effort.
One of those MPs, Nick Moran, he's said previously that he's not anti-vaccination, he's pro-vaccination, but he just doesn't agree with allowing his medical records to be made public. How do you respond to that? And also the legalised cannabis MP, she's argued that it's the mandate's a kind of form of disenfranchising and dehumanising that section of the community. So how do you respond to those concerns?
Well, members of Parliament should be treated like everyone else in the community, and that is we all have a responsibility to protect each other. And the Parliament House is no different from any other essential workplace, and that is people want to go there. It's important that they do the right thing and get themselves vaccinated. In relation to the Honourable Nick Goiran, you can't walk both sides of the street. You can't walk both sides of the street. You have to be forthright in the example that you provide to the community. And to simply sit on a technical or acute issue such as I just don't want people to know if I've been vaccinated or not is quite frankly diverting people's attention from the important issue. Is that we will save lives, we will stop acute illness, we will preserve the community from untold hurt if we all do the right thing and get themselves vaccinated. And we don't want people to be going around dog whistling to all the people who are stepping away from looking after each other by these cute arguments. It's time for people to take responsibility for leadership. Get themselves vaccinated, encourage people in the community to get themselves vaccinated.
It's not quite like every other workplace. There's, it's legally enshrined. The access to Parliament by elected members is kind of legally enshrined. So is your government comfortable that you can legally enforce this?
Well, I'm comfortable, and the Parliament will make a decision today in relation to those arrangements. If the Parliament makes a decision that each should be vaccinated and should be excluded at a point in time when we come to a lockdown, well then that is the role and the prerogative of Parliament. Parliament is the master of its own destiny, and if the Parliament makes that decision today, well then obviously we'll all stand by it.
Will parliamentary staff also be banned if they're unvaccinated in the event of a lockdown?
My understanding is yes.
Should the date have been possibly set slightly sooner if it is such a responsibility to show that example to the public?
Well, we had I believe there was a discussion that was had in relation to when that should be. We believe that that is an appropriate date given the transition plan.
Have you had any threats?
Yes, I have had threats, but I'm very pleased to say nothing in the ballpark of what the Premier and the Commissioner have received.
What sort of threats have you received?
Threats to my electorate office via various communication links, and I've found myself in vulnerable situations in the public, and obviously last Sunday was a good example of that.
So just two more. I downloaded my COVID vaccine certificate yesterday, and I discovered that WA is the only state where you can't link that certificate with check-in apps. Every other state and territory is doing that. What's the delay?
My understanding is work has been done on that.
Okay. The other one is South Australia have announced that they're going to organise quarantine camps for Aboriginal people who are unable to safely quarantine at home. Is WA looking at that?
Well, as you know, South Australia have already opened their borders to states that we consider extreme risk at this point in time. So there's a great opportunity for Western Australians to make sure that they can protect themselves in the best way we know how. And that's why we're imploring everyone in the community, but in particular those people in the Aboriginal community who are, by the very demographic, more vulnerable to get themselves vaccinated. This is a vaccine that will stop you becoming seriously ill. It's a vaccine that will potentially stop you from dying. And so that's why we just simply implore everyone to do the right thing.
So are you looking at quarantine camps?
Look, I don't know the details of a quarantine camp, but obviously, ultimately, if we can't get the vaccination rates that we need in specific communities, we'll have to consider making sure we put things in place to protect that community.
The Auditor General was critical in her report that there were roles and responsibilities defined early that state government haven't implemented in terms of the rollout for the Aboriginal communities. Do you accept that?
No, the Auditor General's report was by and large acknowledged that it was a very difficult time to implement the vaccination program. She acknowledged that there were constraints in relation to supplies from the Commonwealth. She acknowledged that there was a changing landscape in terms of the division of responsibilities, and also acknowledged that, unlike other states, the Western Australian state effort has been significantly higher compared to the Commonwealth effort. In particular, though, the Auditor General shares all our concerns that we want to make sure that we get Western Australians' Aboriginal community vaccinated. Under the national plan, that's obviously the primary responsibility of the Commonwealth, but as we've said on many occasions, we stand ready and are working in partnership with the Commonwealth to make sure that we can make the vaccine available to everyone.
Just that announcement today in regards to the funding for those groups. Could you elaborate on those details?
I don't.
Just was in that what was $5,000?
Yeah, I might ask the vaccine commander to provide those details.
Just in the interest of transparency, would you be willing to front the unfair dismissal case with your former elected officer?
Oh, look, I'm not a party to the action. It's a matter between that particular person and the Department of Premier and Cabinet, and I'll continue to be advised appropriately.
Have you ever torn up a leave form?
Look, I'm not going to provide further commentary on that because obviously it's going to be subject of that particular appellant or appeal board. Yeah.
You've said staffing is going to be a challenge going forward with WA obviously opening up and COVID coming in, as you said before. Are you concerned that the WA hospitals won't be able to cope if we do see influxes?
I'm not concerned that WA hospitals won't be able to cope. They've coped all along and done a great job on behalf of the community in relation to COVID-19, particularly in relation to any outbreak. But I am concerned in relation to workforce shortages generally, in particular in regional Western Australia, which is the reason why we're putting such an effort in terms of our recruitment campaign. Thanks very much.
I'll just respond to the question about the community grants. The state has made available grants up to an amount of $5,000 each, and the purpose of these are to provide some assistance to particularly vulnerable cohorts where the vaccination rate does need to improve. And so we are looking at it as a priority, Aboriginal communities, people living with disabilities, those from cultural and linguistically diverse communities, people who are experiencing homelessness, etc. And so special efforts are being made in those particular priority groups, and for instance where there's a Christmas lunch event in the city for homeless people, we'll have a clinic there, but we've already provided, for instance, modest amounts of funding to assist some community buses where some community leaders can be paid a sum of money to assist in encouraging those people that, for instance, are housebound, that have not come to a clinic, to pick them up on the bus. And they have also provided translator services, catering packages, hall hire, those sorts of things that might tip the particular people that we're targeting into a space where they can get on a bus, go to the clinic and get vaccinated, or indeed identify those particular people in living in certain areas where we might put on a small spread of food, and that might incentivise some of these community members to come out and enjoy some small refreshments. At the same time, practically we can provide that vaccine to them. We appreciate that some communities are simply just hesitant, or they haven't been mobilised sufficiently. So this is a grant program which is available for not-for-profits, for community groups to make application, and I've got an administrator that will quickly work through that. It's a short form and can get very quickly approved. Okay, thanks very much.
Thank you.